Welcome everyone to this webinar today called Reproductive Health Innovations, the Rise Up Youth Champions Initiative. This webinar is co-hosted by the Reproductive Health Supplies Youth Caucus together with the Packard Foundation and Rise Up. So this webinar is part of a series about reproductive health innovations, and we're going to talk about the Youth Champions Initiative. I'm not going to say too much because, well, that's for the speakers to talk about, but I can tell you that this Youth Champions initiative invests in young visionary people and enable them to lead the sexual and reproductive health rights movement in their country using a rather interesting philosophy and program. So if we look at the speakers today, after me, Amy Iftikhar from Packard Foundation is going to talk about their youth investment and their youth involvement with youth. After that, Denise Dunning from Rise Up is going to speak about the Rise Up program and the Youth Champions Initiative. And then after that, we have three youth champions joining us who will talk about their perspective. We will start with Marlo Barrera, followed by Frihewot Mohammed, and after that, Neelam Moyes. So after that, we will have a Q&A. At the moment, you are all muted, but you can raise questions in two ways. You can click the raise your hand button on the left of your control panel, or you can just post your question in the question box and then I can read the question. So without me speaking for too long, I will give now the floor to Amy Iftikhar from the Packard Foundation, and she will talk you through their involvement with youth. Amy, the floor is yours.
Thank you. Hi, thank you, David, and hi, everyone. Welcome. It's a pleasure to be here. My name is Amy Iftikhar, and I'm working in the Population and Reproductive Health Program at the David and Lucille Packard Foundation. I work on our Sub-Saharan Africa and our global youth portfolios, and our vision is that we want to make sure everyone can receive accurate, quality, comprehensive information and services when they want it, delivered in a way that is respectful and that meets the needs throughout the changing times in their lives. Our reproductive health and rights program supports three main areas: family planning, abortion care, and comprehensive sexuality education. And we do this through three main approaches: advocacy and leadership, service delivery, and changing sociocultural norms. We have two cross-cutting themes throughout all of our grant-making strategy: quality and youth. This means that every time we make a grant, we think about those two themes, quality and youth. I'll give some examples in a minute of how we apply that lens to our grant making. We feel that it's important that our work is inclusive of young people, meaning that we support opportunities for young people to be engaged, talking, leading the conversation when it comes to reproductive health and rights. And we need to listen because young people are going to know more about what they need in terms of reproductive health and rights than we do. I've been working with the reproductive health and rights team for 11 years now, and I've seen an evolution in our grant making over the years. We've always had a focus on youth, and I've always felt it was important to consider the specific needs of young people. Yet I think there's been a shift to engage young people more actively rather than sort of, I guess, more passively. Sort of, as I would say, a simple example would be that if like a proposal came in recently, you know, young people would be participating in this conference, and then we would go back to them and say, you know, how are the young people giving input on the design of the conference, and are they speaking on panels? Are they engaged in how are they engaged in the process? We want to hear young people's voices and know their ideas. We want the young people taking the lead and shaping the movement. And I think this evolution in our grant making has let us support some really new and creative, innovative projects that are informed and often led by young people. So Rise Up Youth Champions is a great example of that you'll hear more about. So I won't include them here, but I will give some examples of how we supported grantees to apply a stronger focus on youth, or even add a focus on youth when it was not there before. So again, I'll reiterate, but our themes are quality and youth. And here I'll give a few examples how we've applied that lens when we've invested in certain organizations. And so I'll start with an example around advocacy, or changing the global discourse. And actually, I'm going to start right away with speaking out about Reproductive Health Supplies Coalition. We have supported the coalition for a number of years, and it was more recently the idea emerged to be more intentional about linking young people and the work on supplies. And we gave support, not only financial support for the Youth Innovation Fund, which has been very successful, but for the coalition to examine ways to broaden their understanding of linkages between access to affordable quality supplies and adolescent reproductive health, and to increase this participation of young people in its work. So the coalition established the Youth Caucus, with some of you are members, and we are grateful for that coalition. That coalition has been able to formally integrate, the coalition has been formally integrating and engaging young people and has built this into its structure. I think another example of where we've looked for in sort of service delivery, we have supported a youth-led process around service delivery implementation. In Ethiopia, this was a new idea that came up last year. The goal is for youth-led organizations to come up with ways to deliver adolescent sexual reproductive health services. So we'd seen over the years many models around peer education, and this time we wanted to see what young people would implement if given the opportunity. So we funded a youth-led organization to manage the competitive process where youth-led organizations and coalitions apply for grants. Four grants will be given to the youth-led organizations to implement these pilot projects. And at this point, we don't know what the outcomes of the pilot projects will be, and if they will all succeed, if they'll end up being scaled up and that type of thing. Yet our program, in collaboration with the government of Ethiopia, is supportive of this youth-led process. And we know that just by giving these organizations and young leaders the opportunity to design, implement, and fiscally manage a project is a great outcome in and of itself. And then an example around social norm change, we've sought out a sort of a broader range of organizations that are youth-focused or youth-led. So donors tend to kind of go with longer established organizations and that have shown impact over the years, and certainly we've done this and still do this, but we're supporting newer, perhaps a little bit more non-traditional organizations that share information about adolescent sexual reproductive health in a way that appeals to young people. So in India, we supported some organizations like Agents of Ishq and Love Matters that are doing a lot around sex positivity and normalizing sex through social media. And we've heard from young people that their lives are complex, they're integrated, they face cultural taboos in their real life, whereas online they are more free to ask and search about topics related to sex and sexuality. And they also want the information that is entertaining and positive and fun, especially when many times they've received these messages that are negative or produce stigma or just plain dull and uninteresting. So we think that Love Matters and Agents of Ishq are changing that pattern, and they've been very successful at reaching large numbers of young people. And even Love Matters was is the first online platform to offer that information in Hindi, which can really exponentially increase their reach. So those are a few examples how we've invested in youth more recently, and sort of the evolution of our grant making and how we're focusing more on engaging and young people and having them lead this work. And we also know that there are more young people than ever before in world's history, and that young people have a huge potential to help shape their communities, their economies, and at a global level. So that's why we want to invest in young leaders such as the youth champions. So I will now introduce Denise Dunning. She'll explain more about Rise Up and the Youth Champions Initiative.
Thank you, Amy. Can everyone hear me? I'm going to assume that's a yes. So thanks, Amy. This is Denise Dunning. I am the founder and executive director of Rise Up, and I'm just going to take a few quick moments to talk about Rise Up and our Youth Champions Initiative, and then hand it over to 3 of our amazing youth champions to tell everyone more about the work that they're doing and their approach to working with young people. So let's see, to start, somehow my screen is frozen. Oh, there we go. Okay. So Rise Up's mission, as you see right here, is to advance health education for girls, youth, and women everywhere. And the strategy that we take is a little different from some. So what we really do is focus on identifying leaders, young women, girls, and others who are doing good work on a small scale and are already communities and know the challenges that they face and the greatest opportunities for change, and investing in them to achieve their own vision. So we're really focused on prioritizing local vision and local leadership to address local challenges within this broad realm of health, education, and equity. So what does that look like? What you see here, these 4 buckets, is really how we think about it. So really finding visionary local leaders, giving them training, funding, resources, networks, and support to be able to create much larger scale impact. So, some people say that we have an approach that is similar to, for example, investing in organizations that have the potential to create large scale change and helping them to get there. So I'm going to move quickly into the Youth Champions Initiative and tell you all what that looks like. So most of the work that we do around the world, we're currently working in 14 different countries, and most of the work that we do takes place in country. And our Youth Champions Initiative is our one initiative that is really different in that way. So what we do is bring together young leaders from a few different places. So India, Ethiopia, Pakistan, and the US South. And rather than doing the work in country, which we do in all of our other programming, we bring them here together in Silicon Valley in California. And the reason for that is because we have a really strong focus on technology and innovation and enabling these young people who, already know their own realities, their own opportunities, and the challenges that they're facing in terms of enabling both themselves and their friends and colleagues and their peers to access sexual and reproductive health and rights information. They already have that lens. And so what we're doing is helping them to both strengthen their own leadership and then also to really expose them to new ways of thinking, new ways of potentially using technology and innovation and taking a new approach to solving some of these really big challenges around comprehensive sexuality education, access to safe and legal abortion, and quality family planning services. So let me give you next slide. This is an example of what that looks like. So, as Amy just touched on very briefly, one of the leaders, we now have 2 cohorts. So we did a cohort in 2014 and now just did a cohort this year in 2017. So we now have 45 youth leaders who have gone through this process. And this is a slide that reflects the experience of one of them. So this is a young woman named Gayatri who was part of our initiative the first time around. And, Gayatri, when we first met her, she had been helping to start Love Matters, the organization that Amy mentioned, which is really focused on love, sex, and relationships and taking a different approach to enabling young people to access information. So making it fun, making it interesting, and really making it sex positive as opposed to, sort of the more traditional and sometimes didactic approaches to giving young people information. So, Gayatri was already doing this great work with her organization. And when she came here, she really learned different ways to think about using technology. And I remember one time asking her about it and her saying one of the greatest things that she learned when she was here in Silicon Valley at our Youth Champions Incubator was that innovation takes many forms, right? And that we often think of innovation as always being technology focused, but it doesn't have to be. And sometimes what's really most innovative is coming up with a way that is, much more low cost than you've done it before, or has much greater scope than you've done it before. And so, while she was here, she actually came up with this idea of using WhatsApp as a messaging service. So Love Matters had this great platform where young people could go to find information. But obviously a web-based platform is a one-way form of communication. And so she realized that if she could use WhatsApp and integrate this messaging service, young people could actually interact with this information and find out more and ask their questions. And so she started a pilot with funding from the Youth Champions Initiative that enabled her to bring together young people through this WhatsApp pilot so that young people would get messages every week on love, sex, and relationships, and would be able to write back and ask questions and get referrals and get counseling and get support where they needed it. And so it was just a really new and smart and very effective way to use what's a free technology to vastly expand the interactivity and the scope of their work. And now Gayatri has been able to scale this work up really drastically, in large part thanks to some funding from the Packard Foundation as well. So this is, to me, one example of how young people are really using technology in new and powerful ways, and how they're using innovation in ways that we don't necessarily think of in traditional spaces. So here's just a quick summary of our impacts. We now have a network of over 500 leaders around the world who's directly been able to reach 7 million girls, youth, and women, and then who've also been able to advocate for over 100 laws and policies impacting 115 million folks around the world. So we have an amazing group of leaders who are just doing so much important work in their countries, in their communities, on a local level, at a national level, and now also at a global level. So without saying any more, I want to pass it over to our amazing youth champions. So we're going to be hearing from 3 of them today. And we really wanted to create enough space and time for them to share their powerful work, because they are by far the best spokespeople for the work that they're doing in the communities that they serve. So I'm going to stop here and just hand it over to Marlo Barrera, who is an amazing young woman who has been part of the 2017 cohort and is based here in the US South, in Louisiana.
Hi, everyone. Let me just pull this up. Thank you for the introduction, Denise. Let's see, sorry. Sorry, I had this and then now there we go. All right, so I work with a group called REJAC, the Reproductive Justice Action Collective. We are based out of New Orleans, and we're a group of Southerners who are working together and sharing information, ideas, and resources to design and implement projects for our community that work within the reproductive justice framework. So yes, we're looking at reproductive health, but we're also looking at all of the ways that the other parts of people's lives affect how they access reproductive health, which includes race, immigration status, socioeconomic status, et cetera, et cetera. So that's REJAC. And REJAC, we work by building projects, right? So we're all volunteer-run group, and our first big project is Plan B NOLA, which is the one that I've been focusing on for YCI. Plan B NOLA, we provide free and by donation emergency contraception to the greater New Orleans area. This is really exciting. This is something that has actually never been done before, sharing resources and specifically really time-sensitive medication through a network. So it's something that we're building from the group. For youth in our state, like, we have a total lack of reproductive health care. It's not mandated at all by the, every time it goes to committee and people try to create a law so that everyone gets sex ed, it never makes it out of committee. So it's something that for the foreseeable future, sex ed is not going to be made available. So besides that, which is a huge thing, there's also cost, stigma, transportation, all of these issues associated with just accessing emergency contraception in general. It's the cheapest you can find it in our city is $42. It can go up to $60. And you know, that doesn't even include for people who are over 165 pounds and may need 2 pills. That totally doubles that price. So we are operating as a medication and information sharing network. So we will be providing a zine that is made by youth that has sex ed information, birth control methods, as well as local resources in there, as well as the emergency contraception, condoms, and a pregnancy test to take in a few weeks to try to steer people away from crisis pregnancy centers, which are these like propaganda machines against abortion and choice. But they offer free pregnancy tests. So by providing this pregnancy test, we hope this will steer people away. So how do we work? So currently we're operating as community outposts. We are working with STAR, the Sexual Trauma Awareness and Response Group, VELA, which is an organization for Vietnamese Americans. We have a huge Vietnamese population here. And then Women with a Vision, who is a really awesome local organization that's been around for 30 years. And so all 3 of them are operating as outposts and giving away the EC, as well as collecting information for us. And all of the people who are working with us, our community support members, they're able to speak with each person who comes in about emergency contraception. They're able to provide 2 pills if they want, if the person feels like that's necessary, and they can give it for free. We ask that if people can donate back any costs, we appreciate it, but we found a company that sells it to us for only $13 a pill, so that's what makes this possible. So essentially, we're working up to this network. People are going to be able to text or call us. It'll go to the community support members who are on call for the week, and they'll get all of the information that's necessary. That includes just like a contact name, what neighborhood they're in, how long ago it was that they had unprotected sex or that their birth control failed or whatever. And we'll have a map of community support members, and the person on call will contact a community support member in the caller's neighborhood. That member will meet them out and bring them all the resources they need, as well as be able to answer any questions they might have, help them sign up for insurance if necessary, and just like be someone who can hear them out. All of our folks are going to be trained to talk about sexual assault and all of these other like touchier issues that also bar people from accessing EC generally. So after that meetup, we'll have a follow-up call for them in 3 weeks. That's going to be that's a really big part of the project, because that's where we can see whether or not people used the resources that were in the zine, if they scheduled an appointment for later. And also, that's when we'll know what's up with the pregnancy test. So we can either help them schedule an appointment to access birth control if they want, or do counseling on all options of pregnancy. So our strategy is that we are all volunteer. So that means that, of course, certain people have the time to volunteer, right? So we have a community accountability team, which is entirely made up of people of color and folks from New Orleans, and they get paid for their time. So we present to them our work as we and they provide feedback and sort of help us correct course if necessary. Generally, REJAC, our members who are able to vote are people from Louisiana and people of color, but the community accountability team is sort of like a concentrated version of that. The community support members, they are also going to be trained, so the accountability also evaluate what the training looks like and ensure that that is appropriate for our community. That training will include everything from the history of forced sterilization in communities of color to, as I said, signing people up for health insurance. So we'll be strengthening and utilizing the existing networks that are already really strong in the South. And youth are involved in every decision-making process. So last, like what can this actually do, right? Like one-time method of birth control is great, but what about beyond that? When people just don't have resources or information generally. So by simply eliminating the barriers of emergency contraception, that's huge, considering we only have 3 abortion clinics in the state. It's also just really difficult to access in many other ways. We're reducing the stigma by creating a conversation, and that's going to be part of when we launch the network, a bigger conversation. We're also going to be able to bridge that gap between emergency contraception and a longer-term method of birth control with those follow-up calls and with the first meeting that folks have. We'll be able to reduce the spread of STDs and reduce gatekeeping to important information by providing that sex ed information. So everyone is able to build their families and their communities as they desire. Yeah, and that's it. That's what we do. So it's really exciting, and we're in a really, really good place right now. We're moving forward, and we're serving people. It's awesome. And so next, I would like to present Frehi Watt, and this is her presentation. Thanks.
I think, Freewa, that you are muted by yourself.
Okay, now I just can't talk to now. Yeah. Hello.
Yes, now we can hear you.
Can you hear me? Okay. Thank you very much for the invitation, for the discussion part, and I am Frehiot. I am working in one of local NGO, working on mainly focused on male engagement issue, but I am working also in my own private media company, Macbeth Media and Communication, and I'm a youth champion too. So I'm going to present a project. I'm not that much fluent to elaborate more, but I will try to do my best. My project is an interactive school mini media talk show for sexual reproductive health, which means when we say that mini media, as the name indicated, that mini is a small and working for a small group of audience. It is located mostly known by schools in Ethiopia. It is like FM stations or radio stations, but it is not a live station, but while using wirely connected speakers in different corner of the school buildings, and using a microphone. So through that wirely connected speakers, we can pass a lot of messages and announcements also. So I use this strategy to address sexual and reproductive health. So my project is targeted on school users aged between 50 until 24. They are young. It is a preparatory school. They will join the next year the university. It is a school before university or college. They are 11 and 12 grade. So my target populations are them. So they need both information and services in regards to sexual and reproductive health. Ethiopia, there is different cultures. Sometimes it is difficult to talk about sexual reproductive health issues with families, friends openly. So this kind of project or this kind of way of addressing this issue is very essential for, especially for young people in the school. So they need both information and services, and I used these strategies, these services also. So as indicated in the my presentation, mostly they need more information. Then as per I collected the data from
Verheewald,
data collection.
Sorry to interrupt
Yes.
you, but we can't see your presentation. You have to share your screen with us.
Yeah, I already shared you.
Okay, you can keep talking. I'm going to try it again.
Okay. So mostly they want to access sanitary pads and also sanitary pads, condoms and contraceptives, and also STI treatments. I aware of these issues by collecting a checklist located or put in clinic and counseling services in the school. So when I collected that checklist, I understood that they wanted more information, and there are also want to have different services in the school. The other point is that the innovative part of this project is, by the way, mostly school mini medias are used for entertainment, music, to convey short announcements than like educative and informative programs as well. So I want to use this strategy to share some information to aware them about sexual and reproductive health, and also it can also address a huge amount of audiences at a time because in the school there are almost 2008 students are learning, so at a time I can address this one. The other thing is manually guided and it is interactive. So this project is very innovative because they have a manually guided. They are manually guided. The manual is based on mostly focused on introductory for journalism and sexual reproductive health. We have prepared 2 manuals to used for mini media practitioners like hosts, presenters, short message conveyors also. So this is the innovative part. What I was using the strategies, developing manuals and also make the existence health and counseling services user friendly. There are services there, but students in the school even do not know about their services. Even they do not have any information that there is a clinic or a counseling service in the school. So by using this school mini media, students start using these services by going to the clinic and the counseling services as well. So the other thing is capacity building training. It is given for school mini media practitioners, counselors, club coordinators, HIV anti-HIV AIDS club coordinators, counselors, students, hosts, mini media practitioners also get information about introductory for journalism and sexual reproductive health. The other thing is Let's Talk School Mini Media Talk Show. It is a talk show transmitted on the school mini media. So the talk show was broadcasted twice a week during their break time and during their lunch time. We prefer to do their lunch time because we can get sometimes to discuss or to interact with the students and to collect suggestions and comments through their through the suggestion box located around the school mini media club. So I used these strategies. The challenges what I was facing is the first thing is the political situation of Ethiopia. Especially at the beginning of the year, the school is lately opened, so the project is a little bit pushed to October, so it affects us, but we compensate that time by adding an additional time to transmit our talk show. The other challenges, school is sometimes off because of different national and school-based exams, so we can't transmit that kind of message during exams and any national holidays or else. So it affects us to use our time properly. The other thing is when you think about service, they are young. The school users are young, age between 50 and 24, so they need sexual and reproductive health services. But it is difficult to put condoms and other contraceptives in a school clinic. It is not allowed by the government and the school as well. But we students have the need, but we can't get from their schools. The reason why they do not allow to put such kind of things is they do not want to provoke and only just focused on their education and their educational performance and ethics also. That's all they gave the reason. But we use different strategies to fulfill their needs. We use referral linkage to different clinics around the school. When they go to the clinic, the school clinic, when they need condom or other contraceptive, the clinic, the nurse was trained, so well trained. So they send them to the clinic, and sometimes she buy a condom and give it to them. We used this strategy to fulfill their needs, but it is a big challenge for us. But there are different needs in a school, and there is also different stories regarding sexual and reproductive health. To mention one story, there was a girl who gave birth while she's learning at that school, and she dropped out from school after that, and her life changed in different ways. So there are stories, there are needs, but the school and the government, the education bureau, also do not allowed to put and to advocate, to provoke such kind of services in the school compound. But if you use different strategies to protect the school users, we can do it. So we did that. So next, in regard to my project, there are, sorry, before that, there are different achievements and recorded achievements we have. That is, one thing is the project can attract different organizations. The strategy, they like it, they loved it, and they wanted to scale up in the school. And I was communicating or discussing with one of the organization executive director to the scalability of the project, and this is one achievement. And also the awareness of the schools due to the mini media also improved. Where we know it by the pre and post intervention assessment of the project, and also the checklists we put it in clinic and counseling service centers. So when you refer that, the school users increased using the services has increased from time to time. So that is the other achievement too. And also the mini media practitioners, the clinic nurse and the counseling service providers awareness also improved due to the training we gave on sexual and reproductive health and introductory for journalism. Because of that, because we could identify that their knowledge is improved because we did pre and post training assessment. So because of that, we can understand that this kind of training can improve their attitude, their capacity, or then their knowledge in regard to sexual and reproductive health. Even the clinic nurse and the counselors need more information updated information. So it gives them a chance to refresh their knowledge and to update informations from time to time. So this is all about it. For the next step, I wanted to scale up or expand this project to different schools in Addis Ababa, the city, or in different regions of the country. And also, I have also a plan to an interactive talk show at national level, using through very famous, popular FM stations or national radios or national TVs. This is my plan, and I'll do it because there is no anything that can engage users or that can raise issues of users in our country. There are some programs, but that is not enough because we have a lot of number of users in Ethiopia. More than half of the population is young pupils. So we have to address them. We have to raise their issue. We have to understand them. We have to fulfill their needs in regards to sexual and reproductive health. We have to protect themselves or make them to protect themselves or to take different actions to protect themselves from HIV, STI, and other related issues also. This is all about what I did. Sorry for... Hello? Hello? Hello?
Hello, we can hear you, yes.
Okay. This is all about what I did, and if there is a question and answer session, so I can answer during that time. This is all about it. Sorry for not well articulated presentation because there is a language proficiency problem. So this is all about it.
So next up is Neelam Moyes, and she is also a youth champion, and she was a youth champion in the class of 2014. Neelam, the floor is yours.
So thank you for providing me with this opportunity to present my work. Hi everyone, this is Neelam, and this is my project, which was entitled as Create a Cascade Training Approach to increase people's knowledge, attitude, and practices for adolescent sexual and reproductive health issues. So this project was implemented in the developing country of Pakistan. And the purpose of doing this project was that adolescents make up to 23% of the population in Pakistan. And within the Islamic context of Pakistan, the subject of human sexuality is considered as societal taboo and associated with strong ideology and moral values, which also restricts the open discussion. And therefore, adolescents have poor access to sexual and reproductive health knowledge and services, and which is very much evident through early marriages in Pakistan, unintended pregnancies, gender discrimination, violence, and low rates of contraception and illiteracy. So the training was conducted through a cascade training approach, which was titled as CREATE, and which is the acronym of the process that the trainers followed from obtaining training to replicating into the communities. So it says that clarify your values, beliefs through the comprehensive training, reflect on the learning occurred through the training, examine the context setting where the replication of the training can happen, then aim to replicate the training by having an action plan, and from transfer the knowledge, attitude, and skills to the people, and finally to evaluate the outcomes of the replication. So this is the whole acronym which we use throughout our training. So our purpose of the CREATE project was to enhance comfort in discussing the sexual reproductive health issues, to create awareness among the community about the SRHR issues, and to expand knowledge, attitude, and skills related to the SRHR issues in the community. So with the collaboration of AHANG, our healthcare providers, teachers, and community workers were trained to provide sexual health education to the communities, who then cascade this training to parents, students, co-workers, and community people. So in order to achieve our objectives, we actually conducted following activities. So there was a 3 days create, train the trainer workshop for the trainers. Then we had the replication of training in the communities under the supervision of experts. We also conducted 2 focus group discussion with our trainers. And we also offered phone counseling services to the communities. And at the end, we received community experiences through phone calls. So these are a few of the pictures of the replication which took place in the Karachi and interior Sindh. So we actually trained 29 young participants. From that, 11 participants were healthcare providers, 10 were school teachers, and 8 providers were the social workers. So 86% of the CREATE participants replicated the training module in different communities. These replications were observed by the facilitator. And in total, 21 replications happened in just 2 months, which was an amazing result for us. And approximately 1,200 community people were benefited by the training modules. However, our master trainers of the CREATE project conducted more independent replications in which we almost covered 1,500 participants. And thus our direct and indirect beneficiaries of CREATE training were more than 3,000 people with the range of ages 6 to 90 years, including parents, teachers, children, adolescents, and elderly, who have received information about child sexual abuse, pubertal issues, sexual harassment, and all other topics which were related to SRHR. So as an outcome of the project, we noted that participants' comfort level and knowledge level were increased in addressing the sexual reproductive health matters, and regardless of their professional expertise, whether they were teachers, they were healthcare providers, or they were community workers, there was increase in the comfort and knowledge level. Then community also found the replicated session extremely useful, and majority of them rated as excellent. The community people also found out that they gained language skills which were related to the sensitive issues. They also build positive relations with their children, and they also enhance comfort in initiating the conversation with their children. After our training, we also organized a refresher course. So after almost a year, so our purpose was organizing the refresher course was to provide them the opportunity to share with us their experiences of independent replications of CREATE modules. And we also tried to address their concerns regarding challenges encountered during the independent replications. So these are few of the challenges which we faced during our project. So the major challenge which was faced was using the word of sexual health in our trainings, but with effective communication with the stakeholders and our master trainers were able to deliver the message to the audience. The other challenge was encountered when the team realized that regardless of enough reinforcement and encouragement, the community didn't use the facility of phone counseling. And I personally made calls to the community people who attended the replication sessions and asked the reason of not using the phone counseling. So the common findings were either all the things were clear in the session or at the end of the session during the corner meeting. And also our facilitators were approachable to the community people, so they didn't feel the need to call the counselors. And finally, we also faced one of the challenge in dealing and addressing conservative issues, because the community leaders didn't seem ready to address such issues and such topics. So the most exciting part of this project was that this program is still sustainable, as it was conducted in collaboration with Akhan Health Board for Pakistan, and one of its mandate to address adolescents' health. So we created the master trainer from the community that can directly serve as a member in Akhan Health Board for Pakistan. And moreover, Out of 26 successful replicators, 9 are going to sign a voluntary contract with Time and Knowledge Nazrana of the Year with Arkan Health Board for Pakistan. Secondly, Arkan Health Board for Pakistan has planned similar train the trainer workshops in southern, northern, and central region of Pakistan from 2018 to 16 to 18. And hence, we are foreseeing that the pool of master trainer will increase in upcoming years. And the trained personnel will then streamline the process in the community to raise awareness about the SRHR services. Finally, Arkan Health Board for Pakistan has also started planning a helpline for which the CREATE master trainers will be opted to serve as counselors. So this is all about my project. And at the end, I would like to thank Noshin Salim, who was the PI of this project. I would like to thank Ahang, YCI, Packard, and Arkan Health Board for Pakistan.
So thank you. I think this was most interesting. We don't have a lot of time left for questions. So if people have questions, they can or raise their hand or post the questions in the question box. I already see a few questions, but first I'm going to ask a question myself. Marlo, I have a question for you. Regarding emergency contraceptives, I think that there might be a group of people that come to you and are in need of your service for repeatedly, so more than once or twice. Is there a way that you deal with people that are in multiple times in need of emergency contraceptives, or is it just a service provision?
So we haven't had that happen yet, but I think that it's important that we pass judgment either way, right? Because a lot of the first thought would be, well, then if you're using emergency contraceptives over and over again, like, why don't you just get on birth control? But the reality is like that's not super accessible to people. It can be expensive, and some people just don't want to. So it's something that I guess is to be considered for the future, but is not something that will ever like deny anybody. But of course, if someone comes up over and over again, that might be something for a follow-up call to sort of just like check in and see where people are at. But we would never decline to give anyone anything.
Okay, thank you. I have a question coming in from Salim. For you also, Marlo, how did you assess the reproductive needs of your community? So how did you do that?
So I worked at Planned Parenthood here. I was the manager and I worked with patients every day. And also at the front desk, like I worked everywhere there. And we just often had folks who came in who needed it and couldn't afford it. And although I probably wasn't supposed to, I would give it to them for free because it just like was not fair to ask someone for $42 when that is like their light bill, right? And that was the choice that people had to make, was like, can I buy groceries this week, or do I purchase this pill? But if I get groceries, then I'm taking my chances and maybe I won't get pregnant. So that just happened a lot. And it was a lot of young people, a lot of people after experiencing a sexual assault who just like didn't want to go to the hospital. And I'm from here, and like a lot of my friends have needed it. There were a couple of people who were providing it sort of out of their homes for a minute, and they saw that there was a need as well. So yeah.
Okay, then I have another question for Frihewat. Any challenges you encountered in obtaining support from school management, teachers, and parents in implementing your project? And if yes, how did you address it? So that's a question for you, Frihewat. Frihewat, can you still hear me?
Okay.
Yes.
Yeah. All the school principals and the school teachers, also the mini media practitioners who are teachers, are very, very helpful to the successful accomplishment of this project. They are very willing to work with us, with the Youth Champion Initiative, and they appreciated me. They like the project because they need it. Students get only academic knowledge from the schools, but they have also there are different needs of schools in regards to sexually reproductive health. Even there is no a culture or trend to talk about sexual reproductive health, sexuality issue with parents. So the school uses parents and also the school staffs, all the teachers and the principals also like it. Very, very appreciation they gave for our organization. So this is all about it, but sometimes the Education Bureau have its own strategy to address these issues, and the only challenge is to allocate or to put different commodities in the school compound, and they do not want to provoke the issue in the school. But we can aware the students and we can give information regarding to sexual reproductive health, and they can link, or they can we can use referral linkage to fulfill their needs of services, to get services.
Okay, thank you. We have a few minutes left. Does anybody else have a question? I have maybe one question left for Neelam. How did you ensure that the trainers you worked with have the information necessary to connect you to youth-friendly services, including access to birth control methods?
So in Pakistan, the majority of early pregnancies occur within the marriage and are intended, although pregnancies and childbearing also occur outside of marriage, which is sometimes intended or unintended. So we actually made sure in our trainings that we provide awareness on ending early marriages, delay childbearing, and change the harmful gender norms. However, it was a challenge for us to deal with the conservative issues, like we had some when our trainers went to the northern regions for independent applications. Moreover, the community leaders didn't seem ready to address the birth control issues at that point in time. Therefore, I feel that it requires further careful consideration or discussion. But what we did was that we keep our trainers connected through the Facebook page we launched. And the purpose of our Facebook page was to provide the update information on SRHR to our trainers, and which also includes family planning information. And we also created WhatsApp group for our trainers, which was found to be a very effective strategy that made it easy for the trainers to communicate with us, stay motivated.
Okay, thank you. I think we have time left for one question. Does anybody has a last question? So there is one last question for Frihewat from Zamir. You create demand. What do you do for reproductive health services? If someone needs service, how do you engage with them?
Okay. Students who want to get some services from the clinic, the nurse discuss with them, talk to them what kind of service they need. So if there is something in the clinic like sanitary parts and other stuffs, they can she can give them. But if they want to get condoms or other contraceptives, we use referral linkage to other clinics out of the school, not in school, because as I said before, it is not allowed to put condoms or other contraceptive pills or injections or that kind of stuff in the school. It is not allowed. So we use referral linkage with different clinics around the school, even government or pharmacies, and that kind of strategy we use.
Okay, thank you. I think our time is up, so I want to thank all the speakers for their lovely presentation and to make time for us to present this. Thank you everyone for your time and for attending, and have a great day.